Good morning. My name is Dr. Vaishali Patel, and I am a breast surgical oncologist practicing in the Peoria area. I'd like to thank Dr. McLean for asking me to speak to you all today about breast cancer and breast cancer awareness. I think a good place to start the conversation is with developing an understanding of what average lifetime risk is, and then we'll talk about what we do about it. And so in this country, 1 in 8 women will develop breast cancer sometime in their lives. What that means is about a 12% lifetime risk for the individual. This number definitely changes depending on the person in front of us. And things that do affect this number are going to be if you have breastfed in your life, when you started having babies, when you started your menstrual cycles, if you've had previous breast biopsies, and your family history. There are some other factors we take into account, but these kind of embody different questions that a practitioner might ask you to help with that calculation. This is a calculation that can be done fairly early in life, and the conversation is recommended to be had at the age of 25 with a provider of your choosing. And so at that age, we do ask that you have that conversation and have this risk assigned to you. This number can change depending on how your family history changes as you age, as well as your own personal medical history. And so just keep in mind that the risk number that you get assigned will change as you get older. And so updating your provider with all of this information is really important because different screening recommendations can be made depending on changes that happen. Currently, most breast surgeons are recommending breast cancer screening start at the age of 40 with an annual screening mammogram, as long as you are deemed to be at average risk. If you have an increased lifetime risk for breast cancer, meaning a lifetime risk that is calculated to be greater than 20% based on several risk models, additional screening may be recommended to you, and this may be recommended to be started at an earlier age. And so we're not just assigning you an increased lifetime risk and not giving you things to do about it. We're very interested in screening patients earlier if they need it. And so the decision to when to start screening is something that you have to talk to your provider about. Different societies will have different recommendations, and so definitely talk to your provider, see what's right for you. Some societies recommend starting at the age of 40, other societies recommend starting a little bit later in life. Some societies will recommend having screening done annually, and some will say have it done every 2 years. It's definitely an individual decision, one to be made with you, your family, and the provider of your choosing.